This conference will now be recorded.
I'm just gonna pause that.
This conference will now be recorded.
Hi, Lexi, can you hear us?
I can. Can you hear me?
Yeah. So I'm gonna try to do something here. Share screen. I don't know how to do this. All right. I don't know if I can you share? I don't think I can. You guys know how to use this by chance? So I'm trying to share the screen.
What's the modality of this? This isn't Zoom, is it?
No.
I've never heard of this. Oh, right there, right? Share screen? Oh,
Yeah.
but it's not that easy.
So I shared it, right?
Entire.
The site will be able to see contents of your Chrome. I don't want Chrome.
Maybe do entire screen, right? Let's see. And then that should work. And then click on entire screen. There you go. Now press share.
Oh.
Let's see if that works. Just missed that.
All right. So it's sharing the screen, but I don't know if.
I got. Hey, good morning. Special education. Yeah. K-2, so the littles. Different age group. Really? Yeah. Yeah, I love it. Just
Chris,
Yeah.
will there be a way for me to share my screen from my laptop?
I think if you go down, do you see the share on the bottom of the screen?
So,
Like on your go-to?
It's
maybe I'll go back. We'll
the
see.
share it says ask the organizer to make you a presenter.
It doesn't say anything about making you a presenter on there.
Do it when you're doing it.
And then in my position with the district,
Good morning. How are you? Wow. Wow, that's incredible. Wow. That's amazing. And you
just as long as I've done.
in the 4 years.
Yeah.
I should be able to share.
Over there. Two.
Chris, I wonder if you put the cursor over my box,
About the work she's doing.
Oh.
if 3 dots show up at the top
I
of the
see you.
corner.
I see.
Were you at the last?
Make presenter.
Last year's umbrella.
No, my name is Kirsten.
Yes.
Oh.
Now you're.
Yay.
I just made you the presenter. Does it work now?
Yes.
Seems like
Uh,
a great strategy.
Yes.
Yeah, oh yeah.
Something
And
today.
apparently there was something.
Thank you, Lexi.
Mhm.
All right. Good morning, everybody. Happy holidays coming up. All right. So let's see. Do we have a quorum? We do not have a quorum today. So this will be unofficial, but we're still gonna meet. We have a lot of important information to talk about today. So, but before we start, I just want to go do introductions again because we do have some new person here today, a couple new people presenting too. So I'm just gonna go around whatever, if you're a sector rep, say if you're a sector rep or a voting member of vote. So I'm Chris Hogue. I'm the program director at Drug Free Communities and co-chair of vote.
Angela Paddle, co-chair of vote.
And member, voting
And
member.
voting member.
I am Andrea Creets, the Public Health Director for the Quabbin Health District and voting member.
I'm Hunter Concio. I'm just attending today. I'm with New Growth Recovery, so an advocate.
I'm Michelle Brood. I'm pastor at Hope Methodist Church, and I'm the sector rep. All right, Alyssa Graham, I'm probation officer down at the district court.
Jay Kroll, I'm with the police department, school resource officer and voting member.
Neil Lozier, police department, and I am law enforcement representative. Voting member.
Thanks. Lexi?
Everybody, my name is Lexi Polikoff. I work for the Spiffy Coalition as the coalition coordinator.
And then there's Aline. She's a guest today. Aline is our guest today. She's not supposed to be working today. Yeah, so.
I don't see her.
Yeah, she's just a guest. So, anyways, well, welcome everybody. And before we start today, I did invite Lexi to come in to present on the Alcohol Policy Roadshow. She was able to present in Ware with Sawyer to their Board of Health and also their Select Board. So it's important information, and these are things that I know we've talked about some of these policy changes and how we can bring it forward. So we'd like Lexi to present today, and then possibly go in front of the Select Board at some point. But I'd like to discuss the policies with our group. Maybe the next meeting we can talk more in detail about what is actually feasible for us to bring in front of the Select Board for any type of policy changes. So I guess, Lexi, I'm going to turn it over to you.
Yeah, thanks so much, Chris. And just so I'm respectful of time, how much time do you want this section to take?
You can, 10 minutes is good. If you need longer, that's fine. If you need shorter, I mean, we're not too tight today, so.
Okay, sounds good. Before I share my screen and share the actual slide deck that we've created, I just want to share a little bit about the background of this presentation. So it was created out of the Alcohol Policy Subcommittee, which is a subcommittee of our Regional Policy Norms Work Group, which I know Chris is part of and some others here in the room are as well. And the subcommittee decided to focus on creating a resource for municipal policymakers to really educate them around how and why regulations that center public health and youth alcohol prevention are important, and how they can be crafted at the local level. So the slides that I'm going to really briefly go through are open for anyone to access, and you can create a copy of the slides and tailor them to your own community. So you could tailor them to Belchertown using Belchertown local data and whatever policies you think would be, like Chris said, most feasible, which would be most strategic to bring to the Select Board. And also to make it as easy as possible for anyone to present this slide deck, there is a script in every single one of the Google slides. So it's a Google slide presentation. So with that, I'm going to share my screen. Okay, can you see that?
Yes, yeah.
Dismiss. Okay, awesome. Okay, so this is just the first title page, and it says in big bold with yellow highlight, make a copy of this for yourself. And so this is, the slide where you just thank everybody, you introduce yourselves. Pretty self-explanatory. And the name of the presentation is Local Alcohol Regulation with a Public Health Lens, a resource for municipal policymaking. This slide goes into just kind of some grounding and level setting about why alcohol policy is important in the first place. So I usually like to kick off this slide with asking folks in the room, why do you think alcohol policy matters? Does anyone have any thoughts on this? And then we go through some of the kind of key bullet points here. First, speaking to, it's an evidence-based way to create positive changes in your community. And, I like to and this is again in the script, but sharing there's a lot in the world we don't have a lot of control over. And this is one of those few areas on the local level, especially because we're a home rule state, that select boards do have some autonomy over. And then sharing that, most people know at least one person in their life that does struggle with alcohol dependency or has struggled with alcohol dependency. And so kind of bringing it home, it is a personal matter. It's the alcohol use disorder is the most common type of substance use disorder in the United States. Alcohol is the most used substance, more than any drug or tobacco product. And it's just so it's ubiquitous, and there's a lot of folks who, there's a lot of negative consequences to it. And speaking of those, there's information in the slide deck here about the negative health impacts. And I think a lot of that counters some of the messaging that was given in the 90s specifically, or even early 2000s, around like a glass of wine a day is good for your health. And that has been completely debunked. That was messaging and quote research created and put out by the alcohol industry. And now we know that technically no amount of alcohol is actually good for you. Just like no amount of cheesecake is technically good for you. Except that I would say that the impacts are a little bit worse because alcohol is a carcinogen now, they know. And that's decades of research actually. And it's now kind of becoming more out in the media now, showing the direct relationship between alcohol and cancer. Excuse me. And then lastly, which I think is another kind of persuasive bullet point, is related to the like actual dollars cost to the community, because a lot of municipal policymakers that's what they have to feel concerned about, is the budget and managing the finances of their community. So the fact of the matter is, when policies promote excessive alcohol consumption, communities actually end up paying more in healthcare and law enforcement costs than was gained in their community's economy. So there are actually quite a few slides. I'm going to go a little bit faster through these. This slide again nails down those three main ways of how evidence-based ways to reduce alcohol-related problems. So limited physical availability and access could look like the number of retailers that sell alcohol in a community, or their hours of operation, reducing or restricting alcohol advertising, storefronts, billboards, family-friendly events. And actually the most impactful way to affect alcohol-related harms is actually by increasing alcohol price, even by a few cents. It has the greatest bang for the buck, which is kind of wild, but it is that intense. So in a nutshell, this slide is the availability and the visibility and the price of alcohol influences consumption and the related health outcomes. This slide has statewide data. And this is taken a lot, mainly from the Alcohol Health and Safety in Massachusetts status report that came out in 2022 by international alcohol expert Dr. David Jernigan. And so these are just a few data points. One is just related to alcohol's role in death and disability in Massachusetts that has been on the rise rapidly, and also Massachusetts ranking pretty high with being a state that has a lot of binge drinking. And then the third bullet point again speaks to that fact that the costs outweigh the revenue when it comes to alcohol in many ways. So I just think this is fascinating. Essentially, alcohol problems cost the state $5.6 billion. So that's $861 per person, or $1.93 per drink. And the government paid directly $2.26 billion of that. So that was just in 2010. This slide is one of those slides that you can tailor for your own community, sharing maybe youth alcohol consumption data and trends, norms and behaviors around alcohol, parents and caregivers, their permissiveness with alcohol. Also, I think in where they had for their presentation, ER visits related to alcohol. The number of police calls that are related to alcohol was like, it was over 50%, but but it's very compelling information. So it's important to dig up that data to bring it home. There is a common misconception that Massachusetts has really, really strong alcohol policies, really, really strict. And in this slide, there's a script that goes into why that's not totally true. We're pretty middle of the road compared to the rest of the country. Some areas we're stricter in, some areas we are far behind in, especially with our alcohol excise tax, which has not been updated since the 1980s. This slide is sort of reframing in maybe a more accessible way how, again, like the effective evidence-based ways of doing alcohol policy that centers youth prevention, public health. So there's the 4 Ps, which is actually taken from the marketing field, and their product, price, place, and promotion. And then in this slide, it goes into examples, what that looks like when it comes to alcohol policy. So product, the design of certain alcoholic drinks, and appeals more to adolescents than they do to an adult audience. Like that's a question to consider when, thinking about alcohol policies. Keep going along. And then the next few slides dive a little bit deeper into those 4 Ps with more specific examples about at the state level what the alcohol laws are. Just to, not everyone knows all of them, and even, municipal policymakers. So for one, example is like alcohol and THC cannot be in the same product, or alcohol products cannot have added caffeine. Then some weird ones you might see here, like candy can't have more than 1% alcohol. Ice cream cannot have alcohol, and we can't have powdered alcohol. So each of these slides goes into some very specific examples and how they relate to alcohol-related harms. Retailer density, hours and time of sale, price, promotion. One that doesn't really fit into the 4 Ps neatly is dram shop liability, and a dram shop is just an old-fashioned term for any business that sells alcohol. And this has to do with liability for alcohol retailers for selling to either minors or overly intoxicated people. And if they get in an accident or something happens, the place of last sale is liable for that accident. So now we're transitioning into kind of the last piece of the presentation. What can municipalities do? This would be a tailored slide that the presenter comes up with for the community. There's some examples here of, this slide could be, everything is technically optional. It's really what you think would be the best fit for your community. This slide is an example slide of just sharing, we know that there are 10 alcohol licenses in our community, 5 of which are, restaurants and supermarkets, and 5 are so-and-so, and hours and times of sale. This is what, just showing that you are aware and up to date with the current status of your local bylaws and regulations. And then this is the slide saying, and some of these, regulations are great, and here's 1 or 2 that we think that could be strengthened a little bit more for these reasons. Excuse me. This is a slide that I don't think is worth ever just going through completely with, when you're presenting, but it's just showing there is a plethora of ways you can craft local municipal policy when it comes to alcohol. And there is also another resource that we created that is like a guidebook. I forgot the name of it, but it's something that I think would be important to share along with your slides to whoever you're presenting to, because this guidebook that we created has like example language for all of these different kinds of local policies. You know, if a town is like, oh, I want to, require keg registration, but maybe it's feeling overwhelmed at figuring out how to like write that bylaw and where to put it. That's what this like guidebook is for, is to be like, oh, this is like specific language in the town of Medford that has it, and this is where they have it, and this is also why this policy would reduce alcohol-related harm. So I don't know if there's a chat, but I will email that to Chris along with the slides for everyone to have. And then the last couple slides here are just sharing that, there's lots of resources out there. There are lots of groups working on alcohol policy that you can reach out to if you have any specific questions. The ABCC, Alcoholic Beverages Control Commission, the Massachusetts Alcohol Policy Coalition, which meets once a month. It is open to anyone who's interested. That's a virtual meeting. There's national groups as well with lots of research and resources. I mean, it's just, there's a lot out there, and these are some core links to get you there. And there's legal support for municipalities. So this slide has, folks who we know are responsive and happy to help. And this is a slide with, again, more resources and links, and including the one I named earlier, Alcohol, Health, and Safety in Massachusetts, a status report by Dr. David Jernigan. Definitely recommend reading that. It's not that long. It's not super dense or anything like that, where a lot of reports I've read before, I'm like, oh, this is overwhelming. It's not one of those. Yeah, it's great. And I think this is pretty much the last slide. I was saying, depending on what county you are in Western Massachusetts, these are some key contacts. Actually, we've got to update the Hampden County one because I don't think Anamika is there anymore. But myself, I'm in Hampshire County. I'm happy to chat and brainstorm with anyone. Ilana Gurjoy up in Franklin County is like one of my key partners in all of my policy work. Andy Otteson out in Berkshire County has been amazing. Gotta have a new Hampden County contact, but these are just some information. And that is the Roadshow.
Awesome. Thank you.
Yes.
Any questions? Anybody have questions? So I have a question for you. One thing I didn't notice up there, well, maybe I just didn't see it. What are your thoughts around like nip ban policy?
Yeah, I think it was an example of a policy in one of the last slides of that slide that had.
Yeah, I didn't see it yet.
I have yet to come across any like research that shows a correlation between a nip ban and decreased alcohol related harms. Partly, I think, because it's kind of a newer, it's newer, and I don't know if just the research doesn't exist or it just there's actually not a correlation. I don't really know. So it's hard to put that out there. I mean, there's an environmental base behind it, or cause behind it. I think it's a good one to rally, especially young people around, because of both the environmental piece of it, but also it is powerful to see like a huge trash can full of empty nip bottles that you find on, in a small neighborhood, or in a park or something like that. And you can, I would say it's kind of evidence informed to do a nip ban, because the more you see alcohol products out and about, the more normalized it becomes. And so there's increased norms, there's decreased perception of risk to harm, which leads to increased use. So there's like sort of like you can extrapolate some relationships, but there's no like that I'm aware of. And I asked David Jernigan about this too, and he doesn't know of any research on it yet either, like the evidence base.
Yeah, so like I know Brewster in Cape Cod has had this for a couple years at least now. 2 or 3 years they've had the nip ban and also water bottle ban at the same time because of the environmental piece of it too. And I'd be curious to even, touch base with their police department to see if there's any like DUIs that have gone, like what has gone down, or if there's any correlation between that even now. But I do know that Brewster, I did talk to a couple store owners there, and they said it really didn't affect their business, like pricing and stuff like that. They said it because that was that's a big argument with people. Oh, it's going to kill our business. It's going to kill our business. And down there, the store owners I've spoken to last year said it absolutely did not hurt their business. And I think people overestimate how many nips they're selling a day and how much it's really like affecting their business. The other argument I've seen about it though, against it is like, lower socioeconomic areas don't have a lot more, money to go out and buy a pint of alcohol maybe that day. So they'll buy a couple nips because that's what they can afford. I mean, I've heard this argument. I don't know how can I say it, evidence-based it is. But have you heard anything about that?
Yeah, particularly to that like equity argument.
Yes.
I've heard that, and I spoke with I'm forgetting her name, but a coalition coordinator out in northern Berkshire County, or maybe southern Berkshire County, somewhere in Berkshire County, and she was bringing up another point of if it's going to be affecting someone with withdrawal, in terms of like putting harm's way, that would be understandable. But if someone is at that point where even some very low socioeconomic status, it is cheaper to buy a bottle of liquor and to use that versus nips. So it's, I don't know, she was making the argument that it wouldn't necessarily negatively hurt someone's health, of lower socioeconomic status because of that. So, and she was also sharing that she knows through her youth and students who know other peers in the high school that students buy sleeves of nips, but they don't go right in the liquor stores to buy them. They go to someone who's sort of outside of the liquor store. They say, give them a $20 bill for maybe like a $14 sleeve of nips and say, you can keep the change. Can you get me this sleeve? And so they get an adult to buy them a sleeve, and then the adult gets to keep the rest of the money to buy their own alcohol. And then they go to school with the sleeve of nips because it's really easy to hide. So it was just kind of interesting to hear like more anecdotes around that.
Right. Wow. And one more question for you. So the towns that you presented to so far or brought the roadshow to, has anybody used this and actually implemented some policies?
Yeah. So for me, I have only co-presented with Sawyer and Ware.
Okay.
And we did like you said, the Board of Health and the Select Board, and that was over this past summer. We actually touched base again just last week to talk about moving forward with next steps, because the Select Board was saying, oh yeah, this is really important. We'll get back in touch with you in the early fall to talk about next steps, and they never did. So now I feel like ball's back in our court, and so we're figuring out ways to keep moving forward. So no policies have been adopted yet, but it's all is not lost. It's just kind of was, I'm sure put to the back burner because alcohol policy isn't the hottest policy topic, I think, in a lot of towns.
This is great, though. I mean, to put this together, we really appreciate it. Anybody else? Yeah, Andrea.
Lexi, do you know of any communities that are doing alcohol policies that would require, I always try to kind of correlate alcohol and like what we do with tobacco control, having like alcohol cessation, like with tobacco, you have tobacco cessation and like the quit lines. You can have those resources available, like at the point of purchase. With alcohol, I mean, if somebody has
That's a good
a substance
idea.
use disorder and they're coming in, it seems like there's more like help advertised for helping to stop quitting versus dealing with alcohol. So maybe that's kind of what I think of as that like harm reduction,
Yeah.
you know, at the point of purchase. And then I don't think anybody would ever do this, but you know what, if alcohol tastes like alcohol, no one's gonna wanna drink it. So let's just ban flavors like we do with tobacco. Because that's what we see with tobacco is all these flavors, and that's why they're banned, is because that's what's drawing youth and drawing people to abuse those products. And the same thing, you know, like banana cream moonshine, she just sounds really good, but I'm never gonna drink it, but you've got all these flavors and other things like tobacco is if you're a tobacco retailer, unless you're adult only, you can't sell anything over 35 milligrams per milliliter of nicotine content. What about that with alcohol? Not, you know, selling above a certain proof. I mean, there's other little things you could do. I don't know how much of a sell they would be because we have select board members regulating something that is literally a public health issue. And that's what I can't stand. And I don't know if it's a mass general law, but I don't think select boards would give up regulating alcohol to the Board of Health. And I also don't know how much control the Board of Health would have in creating a regulation for something that they don't permit or license. But we don't license or permit, for example, styrofoam and, you know, or plastic bottles, but yet local boards of health have passed bans on styrofoam products being sold in certain stores. So we've had boards of health passing, like, I don't know, this was way back, like the supersize drinks, you know? Could the Board of Health step in and possibly have regulations of their own that would supersede, especially if select board members don't have regulations in place? Maybe the local Board of Health can, especially if we have statistics in the community to show that there's a problem and, you know, I don't know, that's probably more of a question for like council. Like,
Yeah.
But still, these are things that I think about and, you know, convincing people that don't have public health mentality, pass regulations, you know, when all they see are dollar signs, it's difficult.
Yeah, Andrew, you bring up so many good points, and I appreciate the way you think about this issue. I think at the very least with Board of Health, even if there are areas that they don't have the jurisdiction to create, you know, bylaws and regulations around when it comes to alcohol, I think the Board of Health could be a really powerful source of like persuasion for, you know, a select board or the zoning board to, you know, be like, hey, this is, I don't know, just to be that public health voice and help inform the policies. So I know Alana Gurjoy up in Franklin County, that I think that's her goal this year is to bring the alcohol policy roadshow to different places in Franklin County. But she's going to be starting with the Board of Health, not because the Board of Health has necessarily a lot of decision-making power, but because she wants to sort of build allyship with the Board of Health to like then then co-present with the Board of Health to the, you know, select board or city council or what have you. So
Could be an idea. Yeah.
I think Belchertown would be really good.
Yeah.
The Board of Health in Belchertown.
Yeah, no, I love some of these policies. I'm already like looking at this to bring forward, like to discuss on our next meeting. One of the things that I want us to think about here is the signage in Belchertown and taking a look around to see the signage. Because if you go over to one of the stores over by the schools, Checkers, it is plastered in alcohol signs everywhere, and it's all the kids go there after school. Now, granted, like with this store, that when they go in there, the owners actually shut down the liquor aisle.
Wow.
Access to the kids. So they've taken that precaution to shut down that aisle to the right when you walk in to the student, but to the kids. But it's basically everywhere, and you can't like watch everybody all the time. But it does normalize it close to the schools too. So that's something that I'd like to, bring forward. But, keep your eyes peeled around town and see what you see for signage, because I think that is a feasible first policy to really tackle here. I do. But, we have everybody's voice, so we'll come back to it.
We've both been in checkers like during like right after school, and it's scary. Like if I wasn't a parent, I would not want my child to step foot in there just because of all the advertising, the visuals that they're exposed to. Even though they can't buy anything, it's tempting. Like
Right.
when I think about when I was young and I had some pocket change, you feel empowered going in a place like that just to buy gum or candy, but that could lead to, well, adults drink and adults smoke, and you want to feel more adult, and so the drive to possibly purchase something, I think, increases.
Plus at that age too, there is a lot of data showing that kids are getting into substances at that age.
Yeah.
So.
Yeah, so it's definitely something feasible that we can take forward. And, like Lexi had on the slides, I'm going to compile some data, specific data around that, and see if I can find some research where there's correlation or evidence around, signage and increase in youth alcohol use. You know what I mean? So I have some research to do around this myself too. So, but
and Chris, that's in the other alcohol resource that we created. It's like all laid out there as well. And I'll just add to, I think that's a great starting place, especially if it's something you've been noticing and others have been noticing in Belchertown. And it could be a really powerful like photo voice project with your Helping Hands group to go around and say, hey, take pictures of everywhere you see that you go and you see alcohol signage, and then like share a little bit about it, like just to get that youth voice in there and how like saying, yeah, youth are seeing this, they care too, and I don't know, that tends to be a really powerful thing.
That would be very powerful. And I know our students would do that too. And, our guest here today is hearing that, right? So, yeah. So, we'll definitely, I think that's a good point to bring forward, and something that we can look in for next year in 2026. So thank you so much. We appreciate it. All right. Okay, so we're going to move on. Okay, so for like discussion item, that's okay. For discussion items today, I did want to make the announcement, Smart Recovery is now moving to East Hampton, to Eastworks, and that's going to start in January. They've been here for over a year now in Belchertown at the rec center every Wednesday. So, they decided that they wanted a new location, more accessible around the college areas too. East Hampton's kind of between the Northampton Amherst area. So that's like a new location for them. So we appreciate them coming to us. I mean, it was like totally awesome that they were able to do that. It's just some of the things that we've been up to. We did go to the winter sports, the parent student winter sport permission event, and we always present substance-free athletics to the community materials. And this year we were able to give out substance-free athletics parents, specific to the parents. We gave out 50 copies, and the Helping Hands student group came and handed those out, helped hand those out. So the parents did get copies of that as well. 11/21 resource pop-up that we had a couple new people come, Charlie Health and New Growth Recovery, and then Empower Health Group was also there. We did not have any community members come. We did decide as a group yesterday at our Opioid Settlement Fund Committee that we are putting this on hold. The reason being, the person that was in charge of it left a week before the first one, and then it kind of just got thrown to me, then thrown to Angela, and it's I personally do not operate this way. I need to have everything planned out and structured and ready to go. And the opioid committee, we also agreed that this has been something we all want to do, but when that point person left, it's been just kind of thrown together, and we don't want to be known for flimsy events or in giving out information, to just throwing things together. That's not who we are as BOAT. And so we did decide to put that on hold. I do know a public health nurse position is available in in Healthy Quabog. So as soon as that point person gets hired, we're hoping that they're going to be the ones that take on this resource fair. It's such a great idea. It's a matter of timing and a matter of work and how we're going to put it together. And unfortunately, Angela, she's a volunteer and was not able to put together some things that we wanted to put together, but giving us more time to do it is going to be helpful to structure that and have it be in place. So that's where that is. We did go to the Jabish Brook Middle School craft fair. We had 54 adults attend the table and 27 youth. Very successful for us. We gave out, I forgot to put it on here. Shoot. We've given out so much Narcan this year. Every time I go table, I'm at least giving 5 or 6 boxes out to the public because people know what is going on now. We've been educating our community around fentanyl and the dangers, of fentanyl being in other substances. And parents are getting the message that when their kids are going to college, they know they're going to maybe experiment. They might experiment. So they want them to be, maybe their kid doesn't experiment, maybe they're at a party where somebody's experimenting, or maybe there's something going on, but they want their kids to be safe. They want their children to be safe. So I've been giving out a lot of Narcan to parents. 11/29, we did the winter night lights. We handed out 107 popcorn bags with a social norm on it that we use, which is 85.6% of all 12 to 17-year-olds in Massachusetts reported not using cannabis in the last year. And that came from the National Center for Drug Abuse Statistics. So we're always trying to highlight our social norms in every activity that we do, because everything that we do is deliberate. Everything we do, we try to make it connected across the board with what our messaging is. So that was just another opportunity for that. 12/6, we were invited to the Pathfinder Robotics Craft Fair this year, which was awesome because every year we try to make another connection within our community. Last year, it was probation. We were able to get into probation, train them on mental health first aid, train them on mindfulness and meditation. This year, we want to make this connection to Pathfinder. Students at Pathfinder are in our catchment area. They're from Belchertown, so we want to be more inclusive of Pathfinder now as a group. So maybe like for next year, I'm already going to be talking to the principal at Pathfinder over the summer to discuss Red Ribbon Week, and they want to do a Red Ribbon Week at Pathfinder. They've never done it. So here we are, able to help another organization in our community embrace prevention. How beautiful is that? So we were at the robotics fair. We had 54 adults, 41 adults, 20 youth. Yesterday we did a Finding Joy Through Mindfulness event. We had 11 adults attend at the Recovery Center of Hope, and we gave out 13 gift bags. So they held the gift bags, which included socks, gloves, hats, hygiene products, fidget toys, little mandala coloring books, like notebooks, candy, and stuff like that. And people are so appreciative. So we were really happy to be able to do that again. And last year we gave 42 gift bags to the Hope Center in Springfield and 12 gift bags to the Honest Beginning. So, we wanted to go to a different place again this year. Next year we'll choose another place to do this with. So we want to try to be inclusive to our surrounding community areas as well. Let's see, we do have the recreation department light contest this weekend, which Boat is sponsoring the first place prize, so we're putting that together. Monday on 12/15, we did our first nicotine-free generation compliance check, which was more successful than I thought it would be, which is great, you know, good news. We had 7 out of 9 pass. And the one person that in one of the stores, I'm not going to say who the stores are, one of the stores did card our person, nicotine-free generation. She was 21. She just turned 21 last January, so it was perfect. And the woman looked at the ID, and then she looked at the nicotine-free generation blue sign that we have in front of all the cashier registers. And then looked again at the ID, but then sold. So like this person obviously didn't understand like what was going on. Andrea and I visited every store week before Thanksgiving and re-educated everybody on nicotine-free generation, made sure the signage was in place. So really at this point, there's no excuse. Like people's employees need to be trained on this when they come in. We don't know what the situation is. Andrea will be sending letters out. They'll be invited to come to the Board of Health meeting, and we'll go from there.
They have a right to appeal it. They can appeal it if they feel like, it was unjust or, whatever. I mean, at the end of the day, the sale was made. The sale was, they sold. So they violated. But this was the first one, and we tried to go out and re-educate everybody first. But it would ultimately be the board's decision if somebody were to appeal it, whether they want to uphold it or not. Because again, if they let it go for one, they have to let it go for the other one, to be fair. But the 2 that sold, we were really shocked. It wasn't the 2 that we thought would sell.
I was very shocked at one particularly. I mean, I couldn't believe it. So we don't know, if it was a new employee that didn't get trained. We don't know. So we'll find out.
They're carding, so they carded everybody.
Yeah.
But they have to look at the birth date to see if they were born on or after January 1st, 2004. And if they were, which in this case they would be 21 in 2025, next year they're going to be 22. They're just never, because they were born on that birthday, they just will never be able to purchase in town. But Lexi's got her hand up.
Yep, Lexi.
Oh, thanks. I'm just curious. So what are the consequences for not passing these compliance checks? Like, it sounds like maybe the first time is a warning, perhaps, or I don't know. What are the consequences?
The Board of Health and their regulations, when they voted on the nicotine-free generation policy, set it the same as selling to a minor if somebody was under 21. So it's the same state fining, $1,000 for the first offense with 3-day suspension. You got to remove all your tobacco products for 3 consecutive days. If they do it again, it's a $2,000 fine with a 7-day suspension, and then if they do it a third time, $5,000 with a 15-day suspension. But there's no tolling period, so some tobacco regulations have a tolling period of 36 months. So during those 36 months, if they sold twice, after 36 months, if they sold again, it starts the clock back at 0 after 36 months. So it wouldn't be a strike 3, it would count as a strike 1. We don't have a tolling period here. So it's literally a 3 strikes and you're out. You can permanently lose your tobacco permit. But at the same time, we also have Pioneer Valley Tobacco Control going out and doing their compliance checks for under 21. So they send in a youth that's trained that's under 21 to purchase. The finding is the same, but this is where I'm going to have to kind of get clarification from my board is because the nicotine-free generation policy was in effect January 1st of this year. Say the two that sold, even though the finding is the same, if they had, let's just say, a former strike for selling to a minor, I think it would be separate. You know what I mean? So it wouldn't count as a strike two, it would count as a separate strike for nicotine-free generation. I would try to keep those two separate so there's no confusion. And again, it's a 3 strikes and you're out if they sell to the minor, but it's also the same for nicotine-free generation. So whichever comes first for the 3 strikes. But I wouldn't combine them. So if they had a strike for under 21 and a strike for nicotine-free, I wouldn't count it as 2. I would just count it as 1 for each.
That makes sense.
Yeah, and I think it's fair because, you know, we want to support the businesses, but again, I mean, when you're selling, you know, a drug like nicotine, which is a drug that's more addictive than heroin, I mean, you have to kind of put that into perspective. It's very dangerous. There's no moderation. They're just on drugs.
And the positive thing about these checks is that they did card them. I mean, so at least they've got that piece down. You know, so I want to take a positive out of it, but you know, I still think it, you know, for the first time go around, 7 out of 9 is pretty good. You know, and then we'll re-educate them again and to ensure, you know, that they are understanding what it is. All right, so just moving on, we don't have much time left. 5/16, May 16th is going to be our 5th annual Umbrella Wellness Fair. And this year we did secure Chris Sullivan as our main stage speaker, not in the playbook. So we're pretty excited about that. He's a former Patriots football player who we've come to know very well because his wife, Kathy, has been speaking pre-prom for the parents every year the last 4 years in the high school. So Chris has been we've got to know them really well. So Chris is a great guy. I'm really looking forward to having him come. You know, when he retired from football, he had some stuff going on and he got into heroin. He had $1,000 a day habit. And, you know, he ended up getting help and got into recovery. And then he met Kathy and they're married now and they speak. So, but Chris is great. And they are actually doing that for our community free. And also, Chris is going to be coming into schools the day before as well. That we will pay for, but the community event, they're just willing to come up here and do it for free. So it's like, they're just awesome people. So we're really excited for that. Updates, just opioid settlement fund updates. I'm the only one here that was there at the meeting. So I just talked about the resource thing. We are in touch. I did some research and reached out to Boston Bullpen. Boston Bullpen is connected to an organization, Halo. And so they are in charge of the family, what is it called? It's for families that have lost a loved one to overdose. So a family can go on to Halo, fill out an application. The person in charge, the point person confirms that they died from overdose, whether it's through a medical examiner, the police department, EMT. Once that confirmation is made, which has to be pretty quick, that application goes directly to Boston Bullpen. Boston Bullpen then contacts the family within 48 hours, 24 to 48 hours, to find out what they need the money for. 48 out of 52 families that have used it so far have used it for funeral expenses, and that's what we're looking at, is helping families out with that. There's a $5,000 cap on it. So we are looking to do a similar thing in Belchertown. So we will be bringing back a speaker from Halo and from Boston Bullpen, the 2 people that I got in touch with, and they're going to come to our opioid fund and just talk to us about specifics. We may actually partner with Halo if that makes sense, but we'll talk more about that later. So I just want to let people know what we're doing on the opioid committee right now. Public health, any public health updates besides, okay. Drug-free communities, like I said, we just did the compliance check. Our grant has come out, the drug-free communities grant. I haven't looked, it was supposed to come out on the 15th and be live, but I haven't been able to see it yet. but it will be due January 31st. So we will be applying for that grant again. Additionally, our town report is due January 15th. I'm almost done with it already. I jumped on it just to get out of the way. So we just need some more, statistics to add to it for the end of the year. That's about it. And then our students are, this is great news. Our Helping Hands, 5 of our students will be 3 of us will be taking 5 students to CACA this year, which is Community Anti-Drug Coalition of America conference. And so it's great. Dr. Fortin will be coming with us, our assistant superintendent, and myself and Aline. Aline is the advisor. So there's a youth track and there's an adult track. So all the 5 youth will be with a bunch of youth from across the country. It's going to be awesome.
Where is that?
DC.
Wow.
Yep.
Exciting.
Yeah, Washington, D.C. at National Harbor. There's usually about 4,000 people that go from across the country that are like me. And there's people from NIH, NIDA, CDC, DEA, tons of organizations tabling resources. It's pretty cool conference. I mean, you meet so many people and get like more evidence-based information there too. And that's like why I like going, is because like I said before, what we do is deliver it, and I want to make sure keep it everything evidence-based that we do. We don't want to fall back into any of the old stuff that was done way before us. So yeah, that'll be great. Just trying to think, because we're almost done here. I already talked about nicotine-free generation purchase surveys. I would ask Aline to report on her kids, but I'm not going to because she's not supposed to be working. So anyways, I think that's about it. Any partner updates? I think, Hunter, if you just want to talk a little bit about what New Growth Recovery is about, that would be fabulous.
Yeah, absolutely. I have pamphlets here, but we are 7 months in the making. We're outpatient level of care right in downtown Springfield. In a nutshell, we try to offer the best clinical-based care. We do so many different types of treatment modalities. The bulk is mainly like the DBT, the CBT, and the expressive. But we also work with a gym that's in our building. We have a partnership with this CrossFit gym. It is actually being held in an hour. That's for staff and patients to engage in lifting together. We have animal therapy and all other different types of modalities. But from an access standpoint, we work with mainly all of Mass Health. And come the new year, we are going to be able to work with all of Mass Health. Right now, there's just 1 or 2 that has been rather tricky. But again, we're not going to allow anything related to like the business side to become a preclusion. It's really just the motivation of the individual and helping them get the access necessary. We have provided transportation as far as out of like the Worcester area and Weird. I know that transportation's been very tricky out in certain areas like that. So, we're doing everything that we can to kind of mitigate the access. I'm really curious to see how I can work with programs that are working with youth to kind of streamline that of like the 17 and up, because our program is only 18 and up, but I'm starting to notice that there's like this opportunity to make our resources available even for like the young folks that are going to turn 18. We are also working a lot with the courthouses and folks in the probation side of things. So I'm super passionate about collaborating with you all, and I'm going to leave some pamphlets. I've also worked with Andy Otteson, by the way, Lexi, and he's incredible. Oh, sorry, I just caught you. Yeah, Andy Otteson is incredible, and so I'm just trying to work with everyone that I can as I'm newer to this space. And New Growth Recovery is only 7 months in the making, so we're really just trying to make ourselves available.
Yeah, that's awesome. And Aline and I are going to be visiting there next week on Monday, so we're really excited about that. Just to see the new facility and see how it goes.
Yeah, if anyone's interested, please reach out to me. I can leave my contact info. we're on the 15th floor right next to City Hall in downtown Springfield. I'll valet your car, just come on up and say hi. I think it means a lot to say that you've been in a facility, you've met the people, so that way it's more personal when you're making a referral or you're getting the word out. Would love to have you come.
Awesome.
Yeah, thank you.
Thank you so much. Any other partner updates at all?
Absolutely.
All right. I think that's it. So we're just going to close the meeting today. It wasn't an official because we didn't have our quorum, but I just want to wish everybody happy holidays. And thank you, Lexi, again for coming and presenting. And if you can shoot me over that information, that would be awesome. And I can start the guidebook or whatever, and then I can start looking at that too. But awesome. Thank you so much.
Yeah.
All right. Have a great day, everybody. Jay, I need you before you go.
Okay. It's for everything. Everything's up, so if we could continue was part of that.